And we are live.
Good afternoon, City of Wilmington. I'm Hanifa Shabazz, President of City Council, and welcome to the Wilmington Government COVID-19 Working Group's virtual town hall meeting. Today, you will hear from our panel and working group members, Mayor Mike Pizicki, Council Member Chris Johnson, former Secretary of the Department of Health and Social Service, Rita Landgraf, and Community Advocate Hanif Salam. Thank you all for all of your work during this pandemic and your participation here today. Also a member of the City COVID Working Group is Ms. Maria Matos, Executive Director of the Latin American Community Center, who was not able to join us today. I also want to thank all of our essential workers. They're the ones in the trenches, our nurses, doctors, EMTs caring for the sick, our sanitation workers picking up our trash and recyclables, postal workers delivering our mail, grocery employees that keep our grocery stores stocked, and our police officers and firefighters that keep us safe. We thank you and we appreciate you. In such a time of uncertainty, it's important that you know how, what, and why we're working as we are to meet the needs of our great city during this unprecedented pandemic. This is our first town hall meeting, and we will host more as needed in the coming weeks. I know that you've been inundated with important informational updates from the governor, but as the state's largest city, you need to be aware of how that affects our city. And more importantly, what we can and cannot do under the state of emergency and what we know and do not know. Additionally, we need to hear from you. You've been affected by this pandemic, answering whatever questions and concerns we can. Most importantly, we need your input and recommendations as we build solutions to meet the upcoming unknown needs for recovery for our city residents. And with that, it's my pleasure to introduce Mayor Mike Pizicki, who will bring you greetings and the state of our city. Mayor Pizicki.
Thank you, President Shabazz. I think you framed the issue very, very well. I want to welcome everyone to our virtual town hall. It's being held today to share information about COVID-19 and the ongoing efforts to meet our community's needs. As President Shabazz said, the panel is going to answer questions from those of you watching today who have questions about these issues. I too want to thank the working groups, the government working group, consisting of 6 individuals, 2 members of council, 2 members of the administration, and 2 members from the public. Plus the community working group consisting of 20 or more agencies, all of whom are contributing to this issue, for focusing on helping everyone in Wilmington get through this crisis and for sharing information with the mayor and council to help government make important and informed decisions on the public's behalf. This pandemic, as it has been called, has changed life for all of us. All the assumptions we've made in the past no longer apply where our health and our financial security is concerned. Our city government is no exception. Revenues are going to be much less this year than originally projected, and services may well be impacted. But you should all know that we have been working diligently over the past several months to craft a plan that will get us through the next several years, if in fact that's as long as this takes. Over the past 3 years, we have budgeted carefully and restrained spending, which has resulted in a healthy budget stabilization fund on top of over $16 million in our budget reserve fund. This will allow us to get through this year without deep budget cuts. Unless the economic future darkens even more, we ought to be able to manage our financial affairs effectively over the next 2 years. In addition, we should all feel confident that we've laid the groundwork for a strong recovery at such time as the crisis passes. We have literally 1,000 apartments being built throughout the city. There are hundreds of millions of dollars being invested, including the transformative purpose-built project in the Northeast. Our Parks and Community Center has been fully renovated. Eden Park, Hicks Anderson, Rodney Square is close to being completed, and the Southbridge Wetlands Project, advocated for years by President Shabazz, is close behind. And the renamed Baynard Stadium is prepared to host football games in the fall, God willing. Our streets are being repaved, as all of you who travel the city know, and infrastructure, water and sewer infrastructure is being replaced throughout the entire city. In short, our city is poised for a strong rebound when the light turns green for our economy's reopening. I want to thank President Shabazz and Councilman Chris Johnson for their advocating for assembling a COVID-19 committee consisting of council and the administration. They have done excellent work already and will continue to assess the city's needs and find the resources necessary to meet them. These committees will provide the necessary information for our residents about testing, about masks and equipment, about resources, and they will help deal with the very unique circumstances we confront today. I want to reassure residents, as been said many times by people throughout our country, that we're going to get through this, and especially here in Wilmington, because we have people working together who care deeply for one another, working together on your behalf. We are deeply concerned, you should know, about the disparate impact on our minority communities, and we will do everything in our power to avert that circumstance from arising here in Wilmington. So thank you very much for being with us. I want to turn the program back to President Shabazz.
Thank you, Mayor. As the Mayor stated, that the forming of the internal working group has been working diligently with a very exciting collaboration of the Wilmington COVID Mobilization Community Working Group. And that consists of approximately 20 other organizations that were partnering with the Wilmington Community Advisory Council and others so that we could make sure that the least needs of our community are included in the assessing of resources and the application of the needed, not just health initiatives, but also as we come through this pandemic, that also of the recovery. This group has shared information, and our biggest focus is to make sure that that information gets down to all segments of our community. We've created communication means by connecting our networks, so that if we hear of assessment spots, locations, we hear of food giveaways, mass giveaways, that information gets out to the massive of our community. And I'd really like to congratulate that team for the pulling together, putting all of our resources together so that we can ensure that everyone within the city of Wilmington have access and are updated education on the events that's happening with this COVID-19. If we can go to the next slide, please. Those are a few of the members that are part of our group. As you can see, it's quite extensive, quite diverse, but we knew that we needed to, again, work this all together because as the statement goes, we're all in this together, and the demonstration of the work of this mobilization group thus far demonstrates that we're all in this together. But I'd also like to talk about the triple effect of our most vulnerable population is the Black and Brown community. From this pandemic, are unsettling. And sadly, a light has been shined on the numerous structural, economic, and education inequities that exist in our country for decades. And as the data is clear from COVID-19 effects, the Black and Brown communities is hit the hardest. And so there's an urgent need to work collaboratively to make sure that information resources are shared directly and equitably as possible throughout the city. So it is with the goal of this working group that we're doing will result in a substantial and sustainable growth in the health and wealth of our citizens, and that are collectively put into measures to address the structural inequities that plague many that live here in Wilmington. And these inequities requires the passing of legislation and policies that may result in population behavior changes and not just programmatic action, which disappears when funding runs out. We've currently identified where the CARE Act dollars are, what is being done with those COVID relief dollars, and how can everyone access those dollars. We know that the Small Business Administration is taking care of our small businesses and nonprofits, and we're also looking and collaborating with those nonprofits to mitigate and to disseminate their resources out to address the social services that their mission statements say. We're dealing with the education of our youth. We know there's a great lack of access of internet and computer technology that's being filled and being addressed. We know there's probably going to be a decrease in summer camps. So we need innovative tutoring and mentoring supplements are urgently needed to assist a large portion of our scholarly learning gaps that we know already exist. And that goes across all economic and social lines. So we know of all of this data, the data we know of the need, and I'm glad to be working with such a group as the COVID Community Mobilization Group to come up with an action plan of how we're going to address it. So no more task forcing, no more looking in data, it's now action plan for resolving. So with that, I'd like to turn it over to Councilman Johnson, who has more comments regarding our plan of action.
Thank you very much, Council President. This, and again, both Council President and Mayor have really hit the nail on the head that this is unprecedented. And we've chosen the team approach because that's the best way for us to approach this crisis. We each can't be in our own silos. So we all know that we're going to have many difficult times coming ahead. And so housing and shelter is our #1 priority. Working with the administration, our action plan is to provide both aid to renters and also homeowners. Obviously, the homeless population also is a focus of ours. And right now, resources and gathering resources is this group's top priority. There have been federal funds recently made available to the city that we will, again, give updates on, but we must be in this together. And the idea is right now there is an eviction freeze because of the state of emergency. Governor Carney is, stepped up right away to make that apparent that evictions can't happen now. But we still will have a looming crisis because the bills continue to accrue with renters and both homeowners. And so as a city working group, we're working on finding the solutions and not just kicking the can down the road, but finding a way so that folks can be made whole again, whether that's direct payments to landlords or some kind of other creative resources. We have to have a way so that there's not a huge bill due at the end of this crisis. And also, we are very adamantly looking at the health and crime aspects of this epidemic because the social ills that existed before the epidemic are just made worse during these times. And so we are very aware that there's going to need to be assistance through working with our local nonprofits to make sure that folks stay engaged, that folks who need services continue to get services through either the state, county, or local offices. So crime and public safety definitely is a priority for our group, and we're really looking to work with our nonprofits on the ground to making sure that the youth who are, bored and at home during the summer have something to do, and also that folks just are able to continue to thrive in their neighborhoods. So many updates will come through our group, but I just wanted the public to know that this is something that we know and are aware of and working to get the resources from both the state, federal, and county agencies that we can help solve this epidemic. And without much further ado, I would like to introduce the former Secretary of Health and Social Services, Rita Landgraf.
Thank you. I really appreciate being a part of this narrative and how all of us are aligning together, especially with a focus on the City of Wilmington. As Council President has identified, we do know of the health disparities that have occurred for decades in our Brown and Black communities. And we have seen how those disparities are ever present now because of the spotlight on COVID-19. And of course, because of the impact of COVID-19 on certain populations. I wanted to talk today about what is occurring now in the level of assessment. Sometimes you will hear the word screening, and what you are seeing now happening across our city. And what does that entail? Whether we call it an assessment site or a screening site, but this is the availability thanks to our hospital systems in looking at how did they extend the arm out. And fortunately, they're able to do that because we have flattened the curve within our hospitals. The hospitals were expecting to have much more people entering their establishments because of the impact of COVID-19. However, because of the restrictions that the state of Delaware has put on, we actually have been able to flatten that curve. However, we don't want to be lax, and we still need to do those things that you've been hearing about: social distancing, wearing those masks. So we not only protect ourselves, but we protect each other as we continue to navigate COVID-19. So an assessment site or a screening site is when our hospital systems are identifying with the COVID-19 mobilization committee, where would it be appropriate for them to come out and be available to the city citizens in a way that we could really provide the offering of what we call testing. Now, this testing currently is only offered to people who have symptoms of COVID-19. What we are seeing with this virus is the symptoms are actually evolving. What you heard early on, the symptoms were fever, a dry cough, and heavy breathing. We are seeing other symptoms that are occurring in people who have COVID-19. As I watch what the CDC is talking about, this virus may be mutating, and that's not unfamiliar in viruses or even in flu. But what we want to be able to do with the hospitals is bring the hospitals to the community to partner to offer what we call our pop-up sites. These pop-up sites aren't necessarily stationary, but frequently they may occur in a common location to be able to actually screen to see what type of viral activity may be occurring, and then to even test for those who may have symptoms of COVID-19 across our city. What's really important, along with the screening and the testing, is to also provide education in how do we keep each other safe during this critical time. And even talk about if someone needs the level of isolation. What does that mean? Can they isolate in their own homes safely? Can they quarantine? Isolation is when someone does have COVID-19, and how do they stay safe for 7 days, which means they're not to really have contact with others. Quarantine is when they may have been in an association or direct contact with someone who has the virus, and they usually require a 14-day quarantine to see if they actually will become sick from the virus, and then they may need further isolation. So some of what we are attempting to do is, again, to find where the virus may be occurring in certain locations with certain individuals being impacted. What we hope to do is to keep people as healthy as possible, even if they do have viral activity, so they don't need to be hospitalized. And really, so they don't advance to an acuity that they may have difficulty breathing and may need a ventilator. I do want to share with you some of the things that are occurring that are positive things that we've seen, because Delaware did start early with our restrictions. The positives that have occurred in our state are roughly around 5,778 people. Sadly, we've experienced 193 deaths throughout the state. The negatives, however, are 20,690. So when we think about that, the negatives actually far outweigh our positives, and that's a pretty good sign. Those who have recovered from COVID-19 are over 2,000 people. So we do know that recovery is occurring. Those requiring hospitalization right now, as of today, we have 299 people that have required hospitalization. What is good about that is that our level of acuity seems to be trending down. That's the level of people requiring ICU, the level of people requiring to be on a ventilator. That is actually a really positive sign. So you will be hearing the more testing that we do, the more positives that are occurring, but the positives, the percentage of positives is actually on the downward trend, which is a positive impact. That's why I believe Governor Carney, and probably in communication with our mayor, is really looking at how do we advance towards recovery, but indeed, how do we keep ourselves safe and as we are advancing in recovery? So that will be a staged, I believe, effort. What happens when you get tested? Again, right now, the testing is primarily only available to people with symptoms. And testing can be done in a variety of ways as well. The most common way has been swabbing, and that primarily has been through a nasal swab, which it is probably not all that pleasant, but not necessarily painful. That's called a PCR level of testing. The other PCR level of testing you may have had if you've ever had strep throat, where they swab the back of your throat. Again, not comfortable, but not necessarily painful. That type of testing can take some time for you to receive your results. And we're hoping to make that a quicker turnaround, but the more testing that we are doing, the more things are occurring at the lab level. So it may not be as quick of a turnaround as you might want, and we understand that. We keep looking at how do we make that faster so the results come back in sooner, so you will know what your results are. The other way of testing is an antibody testing, and that is actually blood testing, and it's a quick taking of your blood with your finger. That can actually be get your results back in 15 minutes. We're pretty confident that a positive reading is a positive. Where there's flaws in this testing is on the negative side. And so if you appear to be a presumptive positive that you may have those symptoms and that gives you a negative reading, we are recommending that you also have a swab relative to that as well. What I think you will see happening is the testing will be much more robust occurring again right now throughout the city in concert with our hospital systems, inclusive of Christiana Care, St. Francis, and Nemours, in partnership with our federally qualified health centers, which consist of Henrietta Johnson, as well as Westside. So they will be partnering together. I believe that we have some upcoming sites that I know that St. Francis is doing as what we call the pop-up sites. So on Monday, May 11th from noon to 2, Zion Church will be a drive-through testing site, and that's located at 800 North Walnut Street. On Tuesday, May 12th from 9 to 2, that there will also be at William Hicks Anderson Community Center. That will be a walk-up site, which is at 501 North Madison Street. And then on Wednesday, May 20th from noon to 2 at Judy Johnson Park, which is located at North DuPont and West 3rd Street. That too will be a walk-up site. Christiana Care has what we call more of permanent sites. However, they do ask that you call with an appointment. You will, if they determine that testing for COVID is appropriate, they can test that day with you. That's at the Latin American Community Center. They're there from Mondays and Fridays from 10 to 1. And then also at the Riverside area, Reach Riverside area at the Kingswood Community Center, Christiana Cares there at Tuesdays and Thursdays from 10 to 1. Christiana Care tomorrow will also be doing, I believe, the drive up at Foreman Mills from 8:30 to 11:30. So I think you will stay tuned. There'll be more opportunities for screening, testing, these care kits which are inclusive of, I believe, facial masks and sanitizers. And I know the city, in particular, I know John Rago is keeping track of where our hospital systems will be activating and ensuring that you are aware of that as well. I know the state website that you can go to, the coronavirus website, is also going to have a list of these screening and testing sites made available to the public soon. I know the COVID-19 mobilization is actually mobilizing people on the ground with flyers to make you aware in your community when these sites are available close by prior to that activation, and I believe a couple days prior, so that you are aware when we are in the neighborhood to actually offer the opportunity to get education, to get the care kits, to get the screening and the testing if indeed you're experiencing symptoms.
Well, thank you very much, Rita, for that action plan regarding the assessments. We now would like to hear from our community advocate, Mr. Hanif Salam.
Thank you, and good afternoon, everyone. As stated, my name is Hanif Salam, born and raised here in the city of Wilmington. So it was an honor for me to be able to serve on this COVID-19 mobilization group. And one of the ways that all residents can stay informed about things that are going on is, as mentioned, Delaware.gov, the state's website. They have a whole page dedicated to COVID. You could keep track of positive cases as well as other data on their website. Also, social media is a great way to stay in the loop and stay involved. You can follow my page, Hanif Salam, on Facebook. If you're tuned in, you already know that WITN22 also posts information as the city receives it. But I encourage you to also look up our government officials on social media. Our governor has a Facebook page that he uses to promote information, as well as our legislators. So identifying a legislator in your area, as well as the mayor and some of our city council representatives also have Facebook social media pages that you could always find information on. In addition to that, if anyone affected, and please let me say my hearts and prayers go out to anyone that has been affected by this COVID-19. But anybody who may need resources during this time, 211 is the first option for anyone. If you are wondering what resources is out there, start by calling 211. They will give you all information for the specific need that you have. In addition to 211, for our Latino community, LACC is a viable asset right now. Whether they need to go there, if able, call there. But I know Maria Matos has opened the doors, and the LACC is a viable resource for any of our Latino residents that may have been affected by the COVID. So, in my opinion, to best address some of these inequities that already existed and are really showing through the COVID-19. For one, I think when we look at providing resources for needs, we really need to do a clear assessment of the community. We need to get in touch with the community and see what exactly does the community say that it needs before we begin to plan and find ways to be able to provide resources. I want to be clear. I want all residents, if you don't understand, to know that federal monies through what is called the CARE Act has supplied monies to various states across the country. Delaware has received almost $1.2 billion almost 900 million, if not more, going to the governor's office, and 300 plus million going to our Newcastle County executive. Now, this money is to provide resources, testing and assessments, which I believe our governor and the people that are helping him have done an excellent job at beginning having testing available for anyone who wants to get tested with the pop-up sites and the set locations. This is also to provide relief and resources to individuals that affect the most. And Wilmington being the largest city, they had to use our population in the counts to be able to get this funding. So, you know, I just want to advocate that we do a needs assessment within the community. And just based off of my knowledge, I really think it would be wise for us to create a relief fund, a COVID-19 relief fund for the city of Wilmington. That way we will be able to fill some of the gaps that our council president has mentioned earlier when it comes to education. Yes, the Department of Education has received resources to ensure our children get devices and internet connection. The city has ensured that people can get internet through either relationships with Comcast or the city free hotspots that are available. But in addition to, we still need hands on deck in the community. We need teams of people to be able to help our youth. Not all of our youth are going to be able to just log on to a computer and do the work that's asked of them, right? Some of them needed help even before COVID. And I know that we have community members and agents, grassroots agencies, more than willing to do this. In addition, a relief fund could help with housing. I know that departments have been straight with housing, but as the Councilman Johnson brought up, once this is over, people who have suspended rent is going to owe that rent. People who have suspended mortgages are going to owe those mortgages. And one thing we always said in my community, if I don't have the money now to pay you, what make you think I'm gonna have the money later? So we have to find ways to be able to help people. Another thing we have to think about is our homeless population. Our homeless population, the state has done a very, very good job in partnership with the city of making sure our homeless are not just out on the street during this time. But when this is over, I think we need a way to be able to help more of that population identify and find stable housing. We can't just send everybody back to Christiana Park when this is over. So in addition to education and housing, I also think that with an abundance of resources, and I understand that there are expenses when it comes to government losing revenue, the hospitals doing extra work, but I truly believe that some of this funding could be dedicated to prevention. Gun violence is still prevalent in our communities. You know what I mean? Drug abuse is still prevalent in our communities, and our teens are speaking up, and they're not really happy with it. So if we could use these resources for summer camps and beyond, programs that will go into next school year, programs that could go into 2021, and as we show they're successful, we can identify additional resources to keep these things going. So I think that's an imperative for the community, and what I'm really asking our residents to do is stay informed, get involved, and, you know, only take if you need. That's another thing I wanted to say. You know, we are finding ways to provide resources for everybody in need. But if you out there and you good, then you good. Please do not use some of these valuable resources if unnecessary. But if you need the resources, please call 211, reach out to your city council person, identify the resources that are within your community, step up, get involved, stay informed, and most importantly, stay safe and stay healthy.
Thank you, Hanif, for those words. Mayor?
I want to just simply say, well done to Hanif. I thought that was beautifully done.
And I also like to say that the Wi-Fi that's the mayor has great help to get around the city for our high spots was with a local business by the name of Wi-Fi. That was not necessarily all with Comcast, but Comcast is offering their internet services to homeowners as well. So I just wanted to make sure everyone who is involved in all this is getting their, we know how the whole city is pitching in to provide resources to those that are in need. With that, if there are any other comments from members of the panel, we can go, if there's no other comments or statements anyone would like to make, we can go into our question and answer period of our town hall meeting.
If you mind, Council President, I just want to kind of follow up with what our esteemed panel member Hanif Salam said about funding. I'm sure there's going to be a question about this, about what has happened already, okay? So step one in regards to housing, there was initial $2 million from Delaware Housing Assistance. That was through Delaware State Housing, okay? That went really fast. It's gone, okay? Hopefully the state is able to replenish that. At the same time, through the CARES Act, the federal government did, through their government programs, allotted a certain amount to HUD programs. And that's going to be through community block grant dollars. So the city will be receiving approximately $2 million. And this is to address home ownership issues, also homeless population issues. There's going to be some legislation coming up where we're going to try to get this out to the community as fast as possible, working with local nonprofits. So that is a very good news. So that's coming down the pike right now, because we know April 1st, rent was due. May 1st, rent was due. It's going to be June soon. Rent's going to be due. Mortgages are going to be due. So those are the dollars right now that we're playing with. Now, the additional dollars that are at the state and the county, from a city standpoint, we can't say for certain how much is going to go to the city housing needs. So again, this is where the community can help us to advocate for getting resources here. And so that we can tell the county officials, hey, this is how much money is needed in the city for housing. We can tell the state, this is how much the city needs for housing. So we are certainly doing everything we can right now, but I just wanted to let you know that these are the pots of money. The block grant money from the feds, that's the only pot the city has to assist with housing right now. Again, that's right now. So again, we're making every effort we can, but just to give the real deal to the community, those are the resources we're playing with right now. And again, hopefully more frees up later.
Yeah, I can just one thing to add to that. We have been just for the last few days in contact with the county executive to try to understand what the regulations are, what the rules are from Treasury about the way this money can be used. So it's very early in the game. I've spoken to other mayors about this. We all have needs. We have plenty of places that could use help. There are some funds that we've used that I think are reimbursable already. It might help us a little bit with our budget because some of the funds would wind up being reimbursable, although not much. But we're confident that as these regulations get better defined, we'll find ways that we can get money to be directed toward the city's resource needs. Yeah.
We have a question for Mayor Pizicki. This question is from Deborah. What will the City of Wilmington's path forward be regarding the sanitation of the Lewis Redding building once employees return to work? The building has a lot of moving pieces with this public. Will every employee receive a test before returning to work, or is there a plan in place?
Yeah, great. Okay, that's an excellent question. It's one that we consider every day. We are fully expecting fairly soon that we're going to have more employees returning to the building. We have some choices that we have to make regarding whether we bring people back or we still try to get them working at home. But I can tell you that the number one priority for all of us is the safety of our employees. We have no way to get people up and down 9 stories other than to crowd into elevators, which I don't feel very comfortable with. So we're just going to have to, we're right now trying to formulate plans and protocols which will keep everybody safe. We've considered everything from having a staggered start time so people come in at different times just so we're not jamming into the public areas all at once. We do testing right now. When you walk in the building today, when I come in the first thing in the morning, somebody's there to take my temperature. So we do that every single morning. So we're going to have all the appropriate protocols before we call everybody back, you can be assured, but we're working on this right now with HR and law. Okay.
And I have a question for the council president. Are you purchasing and providing masks for city residents? If so, when will they be available?
Yes. Yes, the working group has worked with local vendors, and it is our intention to provide washable, reusable, because we don't know how long the face covering directive will be in place. So we thought it was more prudent for us to provide reusable, washable face masks. We've worked with local vendors, and we have kind of targeted not being able to necessarily provide for the entire city population, but we know that we have about a good 20,000 individuals who range in that low income area, income range. We tried to make sure that we provide those reusable masks for them. Our anticipated time of delivery is early next week. We're working with our internal working group as well as the community civic associations on our distribution. And once all of those things are final, we look forward to distributing those masks out to our families, and also there would be masks for children. We've also partnered with the Wilmington Housing Authority, who is purchasing reusable cloth masks for their population as well. So they are going to have also another 5,000 for adults and 1,000 masks for children. So yes, we are looking to provide masks, reusable, washable masks for our population that is greatest in need.
And a question for, oh, I'm sorry, Mayor.
Yeah, I just wanted to add to that the committee came to the administration requesting funds to secure those masks, and we found the funds to do that. We're expecting to be reimbursed, but the city found the funds to secure all those masks.
Yes. You have another question?
This question is for Councilman Johnson. Do you know how much funding is being put towards renters assistance? And what is City Council doing to address homelessness? Will you be providing homeless residents with motel rooms? Are you collaborating with other service providers to address our homeless population?
Yeah, so that is kind of a follow-up to statements earlier, is that resources, we are working with our real estate and housing department and making sure that the resources, at least the federal dollars we have right now, we can allocate them to the necessary community partners, nonprofits, to address these same issues. Because there's a lot of organizations on the ground that are already in touch with the most vulnerable population. And so, the city's job is to direct dollars to these organizations so that we can make sure our population is taken care of. Obviously, something further like a direct payment program, any kind of city relief fund that Hanif talked about, that certainly is possible if we're able to get additional funding from the either federal government or the state. So it's really a wait and see approach. Like I said, this first $2 million, we do know we can probably get this out in the community by the end of this month, and the local nonprofits will have these dollars. And as well as dealing with the homeless population and our folks in transitional housing, real estate and housing, of course, is working in conjunction with the state to make sure that housing is appropriately made in the local motels and hotels. The Sheraton is one site that's being used right now. So the state has worked with us to make sure that this is done in a very orderly fashion. Now, obviously, just being realistic, post-crisis, when the state emergency is over, we're going to have to figure out a plan. And that's part of what our working group is working on, because we can't simply have folks go back out in the street because there may be a surge again. So we got to not only keep people in their homes, keep the economy stable, but also we have to make sure the transition is smooth. And so our job as the city is finding the funding in however way we can to make sure, even working with our private industry, make sure that our folks are in stable housing.
And I have a question for former Secretary Landgraf.
Can I add something to that before we move on to the next question? If I can, I mean, I think that is, your answer is right on point, Councilman Johnson, and it's these types of post-COVID issues that we know are going to be something that we're going to have to be able to deal with, and we're working along with our various other levels of government, our county and our state, with the COVID care dollars that they got through the CARES Act, is the plan of action that we need to put together, the relief fund, as Mr. Salam so eloquently described. Those are the type of things that we need the input from our community, which is part of the reason why we're having this town hall, to hear what anticipated needs. We kind of know what major needs everyone is going to need: food, clothing, shelter, education, well-being, and how that pandemic has affected us enormously. So, and those are services that comes from other levels of government, but we as a city, are putting together what that ask is, so that we can advocate to those levels of government who got those those CARE dollars, to help us to cover the cost of that relief, because I know that the city's revenues are not going to be able to substantiate those extra pandemic life issues that we know is going to be facing us in the future.
Former Secretary Landgraf, could you please clarify again the difference between a screening site and a testing site? And are the sites in the city screening sites, or are they testing?
So they're one and the same. The difference between screening and testing is when you may not always get tested, but you can get a screening. Right now, we're not doing universal testing. That would be that any one of us could actually get a test. For the community at large, and a lot of that had to do with the limited supplies. For the community at large, we're welcome to talk to anybody about the impact of COVID-19, but typically the only individuals that will get tested are those that have symptoms that appear to be COVID-19. So the difference isn't in the site. The difference is more about how screening is integrated with testing, how we also want to apply education relative to how to keep yourself safe, and also recognize if people need a level of isolation and maybe their current circumstances do not allow that to happen, or quarantine. I did want to add the other group that we are really looking at are the individuals who are our seniors in high rises currently in the city of Wilmington. Actually, we are partnering with Nemours and Westside and the Life Center that's run through St. Francis to be able to actually screen all those individuals, because as you know, our seniors are at a higher vulnerability for impact relative to COVID-19. So we want to be able to better understand the viral activity. Those who are actually in nursing homes, the state will be doing a universal screening of all individuals who are in our long-term care facilities. And when we looked at the deaths, many of which were our older population who are in long-term care facilities. So there will be universal screening going on in the long-term care facilities.
Thank you, Secretary Landgraf.
Thank you.
Mr. Mayor, this question is for you. How are city departments empowered to assist our residents with vital services as we address COVID-19? Does the city have a comprehensive plan that they are following to address issues? And how much money has the city received to date?
Well, the city's received nothing to date. The way the system is set up is that we will seek reimbursement for dollars that we spend with a reasonable anticipation that those dollars will be forthcoming. As to city services, all I can tell you is that all services should be available. They'll be hindered, as is the case with some of our code inspectors, for example. We have them working at different shifts, so we don't have as many code inspectors available all the time, although everybody's working. Our police officers remain on the street. Our firefighters remain at full force. Our sanitation workers are doing extraordinary work, our street cleaners as well. And we are working once again with the Department of Health so that we know exactly what it is we have to do to protect each and every one of our employees. And there are no exceptions to that.
Thank you, Mr. Mayor. I have a question on our live. Hi, since we are going back to work and schools are closed, what about childcare? I still have to pay my bills. I didn't get help from the state. How am I supposed to go to work if my childcare provider is closed?
Is that a question for me?
You and Council President.
Yeah, no, it's a very, very difficult situation. I mean, my guess is that we're going to have to confront that issue right here in the city with a number of our employees. We have been as flexible as possible to date, but at some point, obviously, we've got to start thinking about policies that are going to go the distance. And so I don't want to say we're playing this by ear, but in a way we are. We're trying to anticipate what's happening. Nobody anticipated it was going to last quite this long. Now it looks like it's going to be a good deal longer. And, you know, we respect our employees, and I think we've got to remain respectful of the realities they find themselves in. It's one thing to say now you've got to bear the cost of childcare, but you may not be able to get a child care center open, and then all of a sudden you don't even have that service available to you. It's happening all over. And so I wish I had an easy answer for you. I don't. All I can tell you is we are receptive to the kinds of policies that acknowledge those realities, and that we're making whatever accommodations we can make with our employees.
And I concur with the mayor that like we said, we're treading uncertain waters right now with this COVID-19. Different issues pop up that that we might not think about if that occur. It affect all of us, which is why we thought it was prudent to have this town hall meeting to hear what your needs and concerns are, so that as we go back to the table with as many minds as we can in all the various sectors that it takes to have a city function. We know what we can do, and go to our other levels of government who provide us support as our county and our state. We share that those are the kind of needs that we need to be able to supply, to our constituents. So as I said, that is something that's all part of this action plan, the relief recovery plan, that is so essential that we start calculating and looking forward, not even just for the next month, but to the end of the year into the next year. Because I think these more issues like that, personal issues, are going to come up and that need to be addressed, and that someone needs to provide resources or answers to.
And can I just say, for anyone who is an essential worker looking for childcare, they really should reach out to DHSS. DHSS is aware of essential emergency childcare sites. So while all childcare centers were not able to maintain and stay open through this, there are a nice amount that will allow you to enroll your child ASAP. You just have to identify the essential emergency childcare that are available in your community or in your area. But we have quite a few in the city and right outside the city.
And while you're speaking, Hanif, I have a question for you. Inequities within our communities were there before COVID-19. First part is, how do we start to have real conversations to address the inequities going forward? And the second part of this question is, how do we reach out to those that are not on social media, that do not use email? Is there a way that your working group can get flyers out or newsletters shared through the mail?
So I'm gonna start with the second part of that question. Currently, right now, the city is working through the beautification project and the community clean teams to do just that, to be able to have individuals, of course, once they're done their cleaning project duties, but to come out and to be able to go door to door and to be able to bring flyers of information, of testing sites, food giveaways, additional resources that would be in that specific surrounding community. So again, the city has found it within their budget right now to be able to have community outreach workers. And I'm not sure exactly what that budget is, but whoever said that is right. We could invest into making sure that this information goes door to door to every side of town, especially to our most vulnerable communities or in areas where we believe that may not be able to access social media and things of that nature. Now, as far as the first part of the question, I just wanted to say that is correct. These inequities have been here way before COVID, and I don't think that we can solve all of them before this ends. But what we need to do is what some of us have already been doing. For one, we have to advocate. You don't know and understand the power of making a phone call to the governor's office, to your local legislator's office, to the mayor's office, to the council president, and to your city council people. You really got to get on the phone and not necessarily snapping and venting, but telling them specifically what the need is, what is the issue that you want to address, and any possible solutions. One of my perspectives is we have a lot of plights because we often want to digest and debate what the problem is with very few solutions. We got to come to the table with our own solutions. And while I'm not suggesting that we could fix everything during COVID, but what I'm doing is putting two and two together. If the state has $1.2 billion, I know we can't have all of it, but now is the perfect time to speak up for those inequities that we know are currently happening and to ask them to address some of those funds to address it right now, and it could potentially carry over beyond the crisis.
Thank you. This question is...
Can I share something there too? Because I would hope that we could get this input for the community. We are currently trying to identify some of our seniors and disabled residents. We do have a list, the city has a list of some of them, but we might not have all of them. I've asked council members to identify them in their districts so that we can come up with a list of those particular seniors and our disabled who might not use social media or on the internet, so that we can ensure that we can deliver door-to-door resources to those individuals. So if you know the address of a senior on your block, please send it to, go to Wilmington City Council's website and send that information to us so that we can ensure that they're on our list, so that we can make sure those individuals get the support and information and resources that they may need.
Thank you. This question is for former Secretary Landgraf. There's lots of information about natural and home remedies that can be used to build up the immune system, thus preventing the catching of this virus. Is there any plan to share information around home remedies that can build your immune system, or food items that you can eat that will help build your immunity?
So in general, you know, healthy foods is important even prior to COVID-19, but right now there is no specific treatment. That's part of the issue that has impacted in a COVID-19 environment. You know, we do, as public health officials, always promote healthy eating, getting enough sleep, reducing stress. Those are things that keep us healthy and well, and taking care of our behavioral health. Unfortunately, you know, I think there's many people working right now to identify not only a vaccine that would, you know, at least if it doesn't prevent the virus, it will at least limit the impact of this virus, just like we were able to do relative to the flu, and in particular 2009 when we had H1N1 and what was also known as swine flu. At that time, there was no treatment or no vaccine. Science has, you know, really improved itself relative to that particular flu. We're very hopeful for the same thing for COVID-19. People that are immune vulnerable indeed are one of those high risk populations to the impact of COVID-19. Unfortunately, this virus seems to impact all of us. We thought children were actually immune. We now are seeing that even children now are having a level of impact. I do want to say, though, again, healthy foods, you know, in the best of times and in times like these, are indeed a remedy to keep us as healthy as possible. Unfortunately, this virus is one that seems to impact regardless. That's why we are hopeful for a vaccine and for some type of a treatment. You know, you're hearing about that people who are in the hospital, there is, you know, an IV that looks somewhat promising. But again, we're so early in this COVID-19 environment that we do have to allow the science to play out to keep us protected.
Thank you. And we have a question for the mayor and council president. Will this plan from the COVID working group be recommendations only, or do you foresee city council making policy changes within the city? Will meetings with the working group be open to the public and open for public comment?
Yeah, I think the council president ought to take this as to the operational aspects of it. But we formed the group because there was no expertise about this issue at all. And so what these two groups now have done is they've been our clearinghouse of all the information, the data, the policies, the prescriptions. Everything that they could find about this issue is going through these committees, as it should be. Instead of everybody being an amateur, we've got people who are focused on this, and so I think of them as kind of the clearinghouse for all information about this. It's you can talk about the public access to them. I don't think these discussions have been public because they're so brutally unwieldy as it is. But Madam President, you got something to say about that?
I do. The mobilization team is a collaboration of numerous organizations and open for you know, input from anyone who comes to the table with solutions to and ideas. So it's not a closed group, and your you know, information about when those meetings are. Of course, if it gets too broad, we won't really get much done, and always open for comments, which is part of this reason why we're having this town hall meeting here, is to get input from the community. So I pray that the results of our, you know, and I won't call it even a group, it's just that we just could constantly talk about what's going on. There's no scheduling meetings, or it's just other than addressing issues when they come to hand. That it does result in legislative change, because when you change policy, then that's how you change community behavior. That's how you change resources coming to it. So if it does need to, issues that we come up with solutions that is being gotten from, as Hanif said, hearing from the public, hearing from other expertise throughout our community. The collaboration definitely will take all of us coming together to address these and to address what's necessary. And if it means that legislation needs to come forward, of course it's going to come to council. And I pray that we, you know, get all the input, collaboration from council, so that we could put these new policies in place that would which I'm quite sure should address the inequities and disparities that we have, and bring about a population behavior change so that we can bring some equality and better quality life to the citizens of Wilmington, which is what the role of the legislative branch of government is.
And I just want to piggyback off of that, Council President. You know, the idea of this is so that we can move swiftly, so that we can move to inform both the executive branch and what actions they need to take, and also the legislative branch about you know, what needs to be done now, because we can't wait. And as is the one issue that we are faced with is everything is urgent, time sensitive, rent is due, there's a public health crisis. So we have a group that can pivot and work very fast. And again, you know, because of the nature of dealing with the executive, you know, branch, we do need to move swiftly, but there is obviously a public facing component of the citywide mobilization group that Council President has highlighted throughout. And so we implore the public to be engaged there, so that they can inform this group about what needs to be done. And we have to take action now. Can't wait.
Unfortunately, we are starting to run out of time. I would ask each one of you to give a final statement as we close. We did have one final question for Mr. Mayor, and that is, as the governor announced yesterday that he's relaxing some restrictions, how does that affect our city?
So, you know, we're a state of 1 million people, slightly less, and I don't think it's very efficient when we have too many people trying to run things and set policy. So I've really deferred to the governor on this. I've given him input. I've given him my input week after week, several times a week, but we of course have to defer to the governor. So we don't have any independence as far as I'm concerned on policy. The governor's setting policy. Their policy, I think, that's generally well received. I think he's got broad support for the things he's done. And so he's starting to relax. He's starting to relax the kind of limitations we've had on business. We're going to see how it works. We're going to see our salons opening up this Friday. I mean, people have been calling about that for some time. There are limits on how that works. We'll see how it is, and I'm certain he's going to want to get feedback from us. But I think we have to be sensitive. We have to be very sensitive in the city of Wilmington that we have densities that other municipalities don't have. You know, we have poverty that they don't have. We have people working in jobs that promote the spread of the virus that other people typically don't have, although they do have them down in Sussex County. So we've got special conditions that we have to be sure we continue to inform the governor of. As I said, he's been remarkably supportive. He's a city resident. He's a big believer in the city. And so I think the long answer to your question then is that we're going to comply with the governor's, with his emergency orders as he tightens them and relaxes them.
Thank you, Mr. Mayor. And do you have any other closing statements?
I will say briefly a synopsis of what we've been saying. This is perhaps the greatest challenge of our time. We don't know just how long it's going to be with us. It creates huge financial problems, and those financial problems create social and behavioral problems within our community at every level. It creates education challenges. It creates challenges for law enforcement and public works, and for some of our real heroes down in the public works who are taking care of basic services for us. So we all have to be equal to the challenge, all of us, and we have to work together as we are. I'm very proud of my council members. I'm very proud of my public participants here. It's heartening to see them, but from what we know of things, if we are at all patient and we keep talking to one another and believe in one another, we're going to get through this. And I promise you, Wilmington will come out of this a much better city than what it was going into it. Thank you.
Thank you, Mr. Mayor. Councilman Johnson?
Yes, I think we've covered a lot today, but I think this is you all participating, you're doing your part, staying at home. You are being the hero, and as a city, we are moving as swiftly as possible to get everyone back on their feet. But just to reiterate, the state cannot move forward until Wilmington is safe and healthy. And so that is why we've stepped up and said, in demanding resources from the county and the state, because if our citizens aren't tested, if the racial disparities continue to exist in terms of those positive cases, then we can't move forward as a state. So we sense the urgency, and that's why we're here to help. And that's why we are, asking the public to let us know what the direct asks we need to make are. Because unfortunately, unlike other municipalities in other states, we're not Philadelphia. We can't just, propose higher taxes or raise revenue that way and budget cuts. No one wants to do that. So we're here to take care of our citizens. So we look forward to having you engaged and involved in this process. And we're here to listen so that we can not only listen, but take action so we can get urgent needs to our community. Thank you.
Former Secretary Landgraf.
Yes, thank you. I just want to thank the panelists. It was an honor to serve on the panel with all of you, and also to thank the participants. I mean, clearly, I can tell by your questions, like we all have similar questions. And as Councilman Johnson said earlier on, this is a time to kind of think of the solutions. Every crisis does provide us a time of opportunity. Sometimes a crisis, a pandemic at this level, it's hard to think of the opportunities within, but I know all of you have submitted some really thoughtful questions that inform and teach us as well. I believe you will be getting a response to these questions. We're sorry we can't answer them directly, but it tells us the level of interest, and it is very heartening. You did stay home. That is actually enabling us to advance to recovery sooner rather than later. I will say, though, that we need a concentrated effort on those who are most vulnerable. Councilman Johnson brought up the homeless community. When we think about people living in poverty, the most vulnerable of the vulnerable, we need to stay very vigilant and focused. And even thinking about how these inequities were here before COVID, COVID just really put the light back on those inequities. The burden of disease, we call that health disparities. How do we stay focused so we can really bring those solutions to the forefront? The gap in education is only bigger now because of COVID-19 and the inequity there. The inequity relative to employment and the number of people that are faced with unemployment. Well, this is the time for us to really think about how do we zero in on those solutions that will bring forth equity for all, which promotes optimal health. Thank you.
Thank you. Mr. Salam?
Yeah, I just like to again start off by saying my hearts and prayers go out to anyone affected by the COVID-19 personally or within their family or their close circle. And I just pray that anyone that's lost a loved one in COVID-19, that you be comforted with peace, man. But to all of our local residents that are tuned in or watching this, please stay informed with what's going on with COVID-19 and the resources available. If you haven't, please get assessed and or tested. It's better to know than to not know. The quicker that we all, or the more people that we test throughout the city, the quicker we can get back to normal. And as I would say, get outside, open back up. And then also, please, give in your suggestions. A lot of times within the city, and I said this early, we are great at analyzing and debating the problems. We know COVID-19 is serious, it's affecting people. We know the inequalities that were even here before COVID, but we are really, really looking for solutions. I don't want the city of Wilmington to miss the boat and take too long with our solutions. And by the time somebody speaks up, they say, oh, we already found something to do with this 1.2 Bs. Sounds like a lot of money, but it's really not. And when it starts getting broken down, you know, it's not competition, but you got to imagine Sussex County has already been getting tested. Sussex County already has a lot of data that we don't have for Wilmington. So as a city, we need to just stay informed, stay educated, stay involved in the process, give up solutions, and most importantly, stay safe and stay healthy.
Thank you. Madam President, for closing.
Yes, first, again, I would like to thank all of the citizens of Wilmington who tuned in today to hear what we felt was essential, that to maintain the level of transparency and inclusion in this pandemic time. This was a way of letting you know what you've represented from the city, along with voices and input from the community, what we are doing to address this COVID-19. It's uncertain, it's uncharted, but we're doing our best to able to address all of the effects of COVID-19 based on following the necessary directives coming from the governor, who's confirming those from the federal government. So we will be moving at rapid speed. So small groups sometimes are good when it comes time to have to, as Councilman Johnson said, have to pivot. But we encourage all of you. I know we had questions that we might not have got to answer, that you can go to. We have your contact information. We will try to make sure that we answer all of your questions, because they're all important to not even get you the answers, but for us to take your points of views into consideration as we make decisions. And there will be, you know, as Hanif Salans talked about, you know, we need to assess what the community needs are. So you might find individuals be in the neighborhood, or a phone call or an email to come to you asking you questions. How has COVID-19 affected you? Please respond. We need to hear that information, because we don't profess to know everything and how it's affecting you personally. But the only way that we can make the decisions we can as your municipal government leadership, that we can make those decisions, is by hearing back from you. And it will be take back to us, dispersed upon all of those who have to make the decisions, all members of council, all members of our state delegation, even our congressional delegation. We would send all of this information so that decisions and resources that are all available for this COVID-19 relief are properly used to the best of it we can. It could be done the best that we can, address some of the inequities and the compounded impact of what COVID-19 has affected all of us, regardless of your lifestyle. You are not exempt from the COVID-19 impact. So with that, I would again thank all of you for tuning in to our first town hall meeting. And we look forward to more to come on various more subjects as things begin to evolve. Hopefully that we will be able to lower the curve of COVID-19 here in the city of Wilmington, and mostly know how it's affecting you, so that we could be prepared to assist you in the upcoming recovery that's going to affect all of us economically and health-wise, as well as educational-wise with our children. So with that, thanks again for tuning in. Again, send your questions to wilmingtoncitycouncil.com if you have any other questions, and look forward to talking with you again at our next town hall meeting. Again, everyone be safe and have a great evening.
Care.